too. Let him take the wheel. So, Dad, go ahead.
Go ahead where?
Continue with your training.
I hadn't started it.
Yeah, at least he's not shaving this time. And look, I see everybody has smiles on their face, and I know they think he's funny, but just imagine this, 365 days a year almost. And that's why I'm not smiling.
Yeah, she lost her mind a long time ago, but I've been trying to get her through that. But anyway, we'll do some training on the product that I would call, if you look at classification of products, this one would be, in our line, it would be, I like to have A products, B products, C products. I wouldn't say we have any that's D. This would be what I'd call a C product. Maybe it should be a B because the name is Balanced D. But it's a very interesting product. It's one that we sell a reasonable amount of, but the one thing about this type of product is based on pre and probiotics in one formulation. And people don't know a lot about that, but there are some basic things that we can talk to you about that are fundamental to the need for this product. Now, if you've ever had antibiotics for anything, your system is out of balance, your GI system, because you have good bacteria and bad bacteria. You've heard that terminology. It's really the microflora, and it needs to be kept in balance. But antibiotics go through and kills it, especially the good bacteria gets devastated. So your system doesn't work well, and because of that, there are many consequential health issues that happen to you because of it. So I've taken an extensive look at this, and I got motivated on this product because there are some people, distributors from another company, and actually joining in ours, and the company was promoting a probiotic product. And so the debate went on with some people that weren't knowledgeable enough about it, but I gave some of the answers to why, but they just didn't, when it was done, the people are still going to use the Sisel products there, but they're going to use some of these others. And I thought, you know, it's important, at least to me, I think it is, that we have products that are absolutely spectacular, no matter what category they're in. And my mission is, when I've created the world's best product in whatever category it is, I automatically start working on ways to make it obsolete. And obsolete means I'll find new chemistries and new systems to put in it. So we've changed some products, like our H-Pill, which is our premier #1 selling product. That's an A+ product for sure. And we've changed that 4 times. And we're going to change it another time in the not too distant future. And you think, well, how good can it get? Well, I'll tell you what, I would have never thought we were to where we are, but science is progressing so much. So I'm finding these changes and bringing them out. And so the next change is, it's actually going to it's shocking. I'm so overly impressed and almost overwhelmed because it's so complex in what we're doing. And this is the thing that most companies don't do. They'll look at a product, they'll see what's trending, they'll bring things in to be competitive. Once in a while, they find something that they think is unique and they promote it to the distributors. And a probiotic product has been promoted by a number of companies, and they're talking about it. That's their A product. Well, for me, I want an A formulation, but it's never going to be an A product, but it fits a very important role in it. But your A products are things like the Triangle of Life, your H-Pill, TSX, those kinds of, the hydrogen stick, those are A products. Usually a company just has one. We've got a lot. At the peak, of course, is the H-Pill. But even there, we're not content because we're working on incorporating newer discoveries we made. Some of these very difficult to, the discoveries made, but to get the ingredient, and we've had to do a lot to make this happen so that you can count on us. It's when you see a product coming out, it's going to be the best that science says it can be, and if we find more, we're going to change it and improve it rather than stay at a lower level. So with Balanced D, I'm going to go through the basics of this, and as this as these distributors were talking with another one of our distributors, in it, they were debating the probiotics back and forth. And it's kind of, I listened to what had happened and what it was, and they love our other products, but they just don't understand about the probiotics that Sisel puts out in Balanced D. Neither did the distributors leading the presentation, but no problem with that. They just know not what they do. And you can't learn everything about everything, but this seems to be an important one. And also it's one that gives me an illustration to show to you just how absolutely superior this product is to others that are sold in the marketplace. And you can extrapolate that and carry it over to all the other formulations of products that we do. So with Balanced D, you have, of course, you are what you eat. You've heard that. But it's not what you ingest, it's what you absorb is the important thing. And if your gastrointestinal tract, your GI tract of your stomach and your small intestine is not functioning properly, then you don't digest food properly. And a lot of other things could happen, particularly with toxins and things like that. So if you look at it, there's colonies of many different types of probiotics. That's, say, good bacteria that's in the system. There's just not one. There could be hundreds that are there, but some of them are primary and very significant, like Lactobacillus acidophilus. That is a very powerful one, and it's pretty fundamental about everybody's product. But many of these strains that are there, I've got to be
down there.
This one.
Oh, down there.
Yeah. Click on the.
I've got lethal problems here.
Click.
Got people trying to flip things on. Well, okay. We're gonna go to the president. You guys want to come around, fool around with this while I talk, and you can figure out why it's not working. I think Liesl didn't just mute me; she probably neutered me too in the same process. Oh, there we go. Okay, so now here's
Click.
balance.
You
Right
just
here?
click.
Okay, I can handle that. Here's Balanced D. And what I'm doing is I'm doing a comparison between two formulations because there are components of each one. And there's the thing which people really don't understand, and that is prebiotics. Prebiotics are really the things that work with the probiotics to make them proliferate better and then to handle the effects of what it does. So most products that you see don't contain prebiotics, some do. So we have looked, and some companies will have two products. Here's a prebiotic, here's a probiotic. Well, that's not necessary because you can put the balance together and get what you want. But here, the big difference is just like apples. An apple is not an apple. There's a certain variety of apple that's there. And you can have Granny Smith, you can have Fuji, you can Macintosh, all of the different types of apples, and they taste different and they are different and they have different properties. Well, it's the same thing with the microflora in your digestive system. It is composed of a number of things, but some are in great concentration. And over the number of years, this science has evolved quite a bit because it's really enzymatic working that's going on with these bacterium to break down the food into small enough nutrients into the components that can work. So if probiotics is the ultimate goal and you need to support it to it proliferates and you need to handle the byproducts of what it does, then you need a prebiotic with it. And that gives you idea, pre and pro. Okay, so I'm going to do this comparison. I have not named the company and I have not named the product. The reason I have not is in some countries like Australia, it's illegal to do product comparisons of brand to brand or company to company. I understand that. But the technological aspects of it can be freely discussed. So that's what this presentation is about, but I'm not relating to any product. You can make your own conclusions on what you do. So if you look at this first page, and this will be a printout you all have, prebiotics, we use a highly advanced a product or prebiotic called resistant maltodextrin, and it's what provides the energy component for the probiotics colonization and development with the GI tract. Most companies use maltose. Now, maltose is somewhat similar, but quite different than maltodextrin, especially resistant maltodextrin. It has a good output of energy, but there are some side effects with it, and some of it is flatulence, a lot of gas that's created from it. So people can get discouraged from their probiotics if they have that kind of issue around others themselves. So what we're doing is we've taken, and I looked at this and I've found this resistant maltodextrin, and it gives higher yields of energy and you never get flatulence with it. So we're going to work with it, and a lot of these, and they're what they call gram positive, and they use the probiotics, and they use glucose as the fuel. And in some cases, instead of oxygen, they don't need it. They work on sulfur, and they're anaerobic. But if they do use oxygen, they're aerobic. So this is how the two line up. The competitor's formulation uses Bifidobacterium lactis. Now, you don't need to know all these names, but you'll have it there. And with that, it makes up about 25% of adult fecal material and about 80% infants. So it's quite a product because it's throughout the system, but it's a second-class product, if you will. They develop it, actually they take it from fecal material and then they culture it and develop it, and then because your body normally doesn't produce, in fact, when you're born you have none of it. It has to be slowly developed within the body. But many people who have a lot of damage done to their system from antibiotics in particular, of course, they need a big slug of the colonies that are in there. And the colonies they put aren't in the thousands or the millions, they're into the billions of colonies in order to get the effect you want. So with that, I've developed this formulation, and there's things that are used like this ingredient we're talking about here, the Bifidobacterium lactis, but it has some very good qualities. It does some very good things. It's well proven, but in some areas it's really just a maybe. But a person that's having a lot of problems with symptoms and issues can be attributed to things other than probiotics. They can be like parasites or viruses or some type of a toxin with that, and the problem doesn't go away. And it's because you don't have the proper probiotic balance to handle it. But with Balance D, we do. So instead of using the Bifidobacteria, we use a highly advanced superior formulation called Lactobulgaricus. And so it's a probiotic strain, and this is probably the most validated one by extensive testing, and it has many proven studies, not just questionable studies, as with the Bifidobacterium lactis. So that we use, and in place of it, it makes more colonies. They're more vigorous, they develop faster, and quite frankly, the larger portion of the microflora that's within your gut is primarily from the Lactobacillus bulgaricus. So there's also something else we use, and that's Lactobacillus acidophilus. And we use that in the Bulgarias together in Balance D, and there's a reason why. Now, I know what these names are. They're just, here's more chemical names than wrong, but this is how this industry works. So if you have a good document like this to support it, you can point out some of it. But Lactobacillus acidophilus is a very good prebiotic, and this one occurs from birth. It's in your body in the intestines, and it helps to maintain an acidic environment in the body, which can prevent the growth of harmful bacteria. and it's used to keep the bacteria in check. So it's a probiotic or a friendly bacteria. But because of the way that it handles lactic acid, it can metabolize it, and it doesn't let your lower intestine get so acidic that it becomes irritated. Because remember, your stomach is very acidic, and then when you go through the duodenal leading into the small intestine, then it becomes base, so, or alkaline if you want to use that term. So with that, if you don't have good probiotics, it goes acid into, and you become in an acid situation in your low intestine, and now you got problems because you don't digest food well. So we use these two different types in combinations to give you the optimum results possible. And those two alone with what we're doing is superior to the other product, as you'll see, because we're using the same. The acidophilus is the same, but their bifidobacterium versus Bulgaricus is inferior to it. I could use the other, but you know, we make it, but there's no point in doing it when you can do it better. Now we have a third strain. Remember, there are hundreds that are within the gut, but there are so many that are dominant, only so many, and these two are, and the other is a new variety of strains that are there, and it's called, the L always stands for lactobacillus, so it's rhamnosus, and rhamnosus is the third stage of probiotics used in Balance D, but it has enormous power. So when you use the first two together, they symbiotically work as a probiotic to aid digestion, prevent diarrhea. This is really a big thing, especially for children and even babies with this, and to relieve the symptoms of IBS or irritable bowel syndrome. And they work, these two compounds, the acidophilus and the bulgaricus, help by maintaining the normal makeup and consistency of the bacteria in the stomach and in the intestines. That's important because many colonies you can put you out of balance, but this helps you to keep it in balance with this combination of these two. Plus they proliferate so many colonies. So when this is, and actually some of them can do damage. This is the only one that's been completely tested that didn't occur some type of damage within the digestive tract. So we make a lot of different claims with this, but I don't know how technical you want to be. I don't think you should. You should talk about the prebiotic, the probiotic, and what it does. But I'm giving you a lot of support information so you can be more expert in it. But when you are developing and improving the gastrointestinal nutrition for the microflora, it grows and rebalances the gut, and this one does it better than anything else. So then we get back to the bifidobacterium in the competitor's formula. It's a widely used one, but it's old time, and it doesn't proliferate in laboratory media. So as a consequence, a lot of time when you get that, the colonies are not so many because it doesn't proliferate outside the body. And that's one of the reasons they take it from fecal material to use. So anyway, it limits the automatic intoxication removal, and it can cause things like arteriosclerosic damage, which leads, this form leads actually to premature senility. So Balance D and the competitor's formula both use the acidophilus. But here's where a big, major, significant difference comes in, and it's the concentration. In Balance D, there are, just in acidophilus alone, there are 250 billion colonies. Whereas the probiotics, and there's two used in the competitor's formula, if you put them together, it's only 30 billion colonies. So that's their total formulation, 30 billion colonies. Just one of our ingredients has 250 billion of just one specific type. So the balance D, when you look at it all, is about 17 and a half times greater in probiotic concentration than the competitive product. In fact, is the total of the 3 different types of probiotics that are within this total 525 billion. So compare that with the competitor's product of 30 billion. That's a huge difference. And then when you consider that our probiotic support for energy, or prebiotics, gives so much more energy, then you have this huge concentration that repopulates quickly to bring your system back into sync. Whereas if you have these other 2, yeah, they work and they proliferate at a certain time, but you don't have the big shot and the tremendous expansion. And then the properties of what they do is the acidophilus is the same in their formula, ours. We just use a lot more. And then, but the others are different chemistries. Now, we have a product that I talked about, the L. raminosus, and it has 200 billion colonies. So if you think about the other, there's 250 billion. Now, here's 200 billion colonies of this one. And this is really, it's the Rolls Royce of all the probiotics that are out there. And there's hundreds of varieties of different probiotic strains. Most of them are not used because they're in minuscule amounts, and the body will balance them out if you can keep the big areas where they should be, and you got enough of the good friendly bacteria to maintain the balance as we talked about previously. But the raminosus is perhaps the greatest of them all. That's what scientists think, and I would agree with them. So here's something to show you, because you can talk about what the first 2 ingredients do, and we have in the competitor's formula and in ours, and you can see acidophilus is the same, but our concentration is immense in comparison. The bifidobacterium that they're using is marginal, and the one that we come through with the bulgaris is extremely powerful and very prolific. So you have those going together. Now you throw in this new one, which you generally don't see, and I put a list here of the 19 benefits. This will help you of this key one. So if you have an ingredient, or if you're selling products, you usually pick a target item and you go after that. If you're selling a product, you have certain support things, but the target item is one of the ingredients, and then what supports it to make it better. And this would be the target item for the product. So you can read with these and the 19 benefits, and as you look at them, it's great for supporting, balancing, restoring, assists in the fight against allergies, things like asthma and dermatitis. And there's a lot of other benefits, including weight loss and anti-canceral support in what it does. It's also what they call a gram-positive lactic acid bacteria, which is so important in the gut microflora because it retains that alkaline balance, or that base, from going acidic. And as it metabolizes that lactic acid quickly and efficiently, then you keep the environment at the right pH for it. Where in the other formula, they have a product that does it to a degree, but not with the immense amount of power this has. So as it supports the immune system, then it has a great deal to do with a lot of other things. And here's some of the mechanisms of support, as you can see it. And it's, I won't do all these in great detail for the scientific words that are involved, but it suppresses the production of inflammation and the mechanism of pro-inflammatory compounds, which cause lots of irritation and allergies and rashes and things like that. It elevates, in particular, some of these, if you know what you're talking about, and nobody does, but it's science, if you elevate the anti-inflammatory IL-10, that is very powerful. That's probably the most powerful one for negating the inflammation within the body. And then it works in elevating and decreasing the interferon. You've heard of interferon together. And then it elevates IgG and IgA. Those are growth factors. It decreases these other ones that are below it. I won't give you the names on them, just because what they are is those are anti-growth factors that suppress it, and they've complexed into something else. So if you notice, the first words are IG, and then on the top, on the ones that elevate it, it's the G and A. The others are a mutation, and they're E, G, and G1, and they actually are counterproductive to it. So this keeps them in check so that you can get all those growth factors going for you. Then it decreases IGF-1 gene expression in the skin. That's very important, because now they found out that IGF-1 has some carcinogenic properties too. And then, of course, the other thing, it affects gene expression. That's epigenetics within the cells. So here's the health benefits for it. And I won't go through necessarily all of this because there is so much. This is a big document, and I put it together myself, and Lisa didn't help me a bit, but I got it all done. And so you can read it at your leisure, but let's just talk about the health benefits from just this rhamnosus. And so it supports weight effect, a reduction in weight effects, especially in women, and reducing fat mass and circulating lipid concentrate or leptin concentrations, which makes you store fat. So in studies, animal studies with mice, it significantly lowered the weight, and the process is in the humans is just the same. So it's very effective, as you can see in number 2, in combating obesity results. It shows anti-obesity, anti-inflammatory is a big issue when a person's overweight with it, and it works with that. And then it skips over and it goes into where it's very effective for liver parameters, the ranges of things that are in it, especially in obese children who have liver dysfunction, fatty liver, and this intervenes with that and helps to correct it. And so as you look at this, it has a lot of properties there, but then it goes in something that has a lot to do with weight loss, but it also involves, it's a big thing in cholesterol, blood pressure, and things like that. And that is, it reverses insulin resistance. Or what we have to say in these, none of these studies have been, or the studies have been done on the ingredients, but the formulation hasn't been evaluated by the FDA. So we can't say the product does this, but you have the right to see the ingredients and what it says it does, and then you can make your own conclusion if you think they're worthwhile and they're in this product and would be a benefit for you. So we can't make drug claims, but we're talking about supporting the body with nutraceuticals or nutrients that allow it to operate at a more optimum level. So when you're talking about insulin resistance, that does a lot for weight loss and for diabetes and cholesterol and things, senility, things like that. And then, as you can see, it significantly supports reduced levels of triglycerides and cholesterol, and of course, the fatty liver content. And so all of these things are working with a system called epigenetics, of where you have a gene and it's like a key that fits in the lock and it opens it. And so the different properties of these probiotics will unlock the keys for certain things to happen. Now look, we're only on number 3 and we've got 19 here. So I'll try and go through those faster, but this is what number 3 talks about, its effects in diabetes and how it works, and anti-hypoglycemic and glucose tolerance and all of that. Then here's 4 is the support for the liver, and it talks about what it does. And this is 60% of the children now are overweight, and 30% of them are obese. That's something we never had to face, at least in most of our lifetimes. It was always, yes, somewhere, but now it's so overpowering. So the probiotics can be so instrumental in doing that because it changes the body's ability to perform its metabolic processes that are necessary to do that much more efficiently. And with overloading the caloric intake, particularly of fatty foods, we have an obesity epidemic around the world with this, but these probiotics, particularly in this Rhamnosus, is so powerful and effective that it makes it much easier to lose weight with it. And so it does a number of other things you can see down here. It protects the liver against alcohol damage. And so, and then it has very small penetrating ingredients to get in and take that liver fat, that you have a fatty liver. That's the one thing they say when the person does a lot of drinking, and it goes through, and instead of being impervious, it penetrates, and enzymes can break that down and activate it, and the body itself will remove the issues on a fatty liver. And so here it is. Here's the support for the gastrointestinal tract with it, and it's good for infections, especially. You get a lot of infections in your stomach because you're out of whack. And as I said before, if you've ever taken antibiotics, you're out of whack. And even if you get your body back in shape and then something comes up and a doctor prescribes antibiotics again, you've knocked your digestive system, your gastrointestinal tract, where it will never recover on its own. It has to have this to bring it back. So this is one good reason to keep on it. But especially after antibiotics, you should go on heavy for at least 3 months with it. So this is, when you think about that and what it's doing, and you think about with children, like with fat and diarrhea, all those types of things, this is very effective for children. And so it a children's system is developing and is so immature that this is a great support to do that for it. So then we're talking about some of the things already. I'm getting ahead of myself, but against diarrhea, and it's really, this is the one product that really supports the body in reducing the risk of antibiotic associated diarrhea that happens with people who are treated with antibiotics. This one is the power that goes out after that. And then, so you have lots of things like the rotaviruses, which are really quite bad now, and retroviruses, because they will get in, they change every season. They cause a lot of infections, but with this one, it will keep the microflora in balance, and then it has the properties to go after the retro viruses that are infecting, or the rotaviruses, both, that are infecting in the body. So here's something with probiotics, which has overcome what antibiotics is. And as you know, doctors will prescribe antibiotics anytime you're sick. You go into the cold and the flu, they're a virus driven, but yet a doctor will prescribe antibiotics which has absolutely no effect on the virus. But what it does have effect is it makes you more sick. It makes you more vulnerable to infection and diseases because your system gets out of whack. So this one is here to support the body to correct that. And that's why it's talking about here about it supports prevention of gastrointestinal infections. And if you got them, it helps a lot there too. So, and then it, you have some types of, you have good bacteria, bad bacteria. Candida is one of the bad ones, and they can really proliferate. But with this formulation and this ingredient, it keeps it in check so they don't get out of control. So then you have a lot of other things that happen, and it supports even things like the body's ability to heal different types of ulcers that occur within it, and actually within the mouth itself too. And so those things, we can't say it does it, but it supports the body's ability to do it. That's the key thing with it. And whoops, I think it went back one. It also, I hit 2 at one time. But anyway, the other one, they're talking about how effective this is in the oral cavity. And it is, you would not imagine all of the things that having your microflora out of balance does to cause gum disease, pyorrhea, and with that comes a lot of other things where it damages many of the organs that are there. And this product is designed to work on that. And so it has a lot of, whoever's on, they could mute. Somebody's muted. But anyway, so it's especially effective in viruses of different types, but here we come into things like pneumonia infection and compromised immune systems and all of that. This is a very powerful product to support the body's ability to do that. This support is natural, powerful, specific, and general in all the things that it does. So that's why it's such a unique ingredient. And so as you read through this and right here, it talks about how it can support with things like pneumonia, salmonella, fighting parasites. And parasites is a big problem, not just fighting them, but excluding them from the body. And they have respiratory infections. And you know, when you get a cold or a cough or something like that, yeah, you got to go through it. Sometimes
It's really going to be a morning this morning.
Can you please mute your?
I'm got a bad wish.
Mute your. Okay, if you would hold it down, we'd appreciate it because it's interfering with the presentation. Just mute your microphone. So anyway, it's been tested extensively in hospitals for respiratory diseases and infections, and you find with children, that's such a bad thing when they have so much mucus, the coughing and everything. And this probiotic goes in and really supports the body in handling that. So even in preterm infants, which really struggle, this is a powerful support to bring them up to where they're supposed to be. And in preterm, they have, within a week after birth, they have a significant change. The effect is coming up to the first month. You can hold that down. If you can mute that, we'd sure appreciate it. I don't know who's doing that, but if you would hold that down. So anyway, here we're talking about children having probiotics. They have fewer days with respiratory symptoms per month than children who did not. It's used to assist patients programs against, well, let's say ventilator-associated pneumonia, but that also covers Legionella, the Legionnaire's disease, which is mainly caused by gram-negative pathogens and like Pseudomonas aeruginosa. And Pseudomonas aeruginosa is the type of a bacterium this really controls, but when it gets out of whack, if you have a genetic inheritance from your that's been passed down to you in your family, a Pseudomonas infection triggers multiple sclerosis. It's but if you have the gene and you never get a Pseudomonas infection, then you never get multiple sclerosis. But the other thing that happens with this is, you know, if you're ever washing dishes and doing things, you use a cloth wash rag, and you, after it sits on the sink, if you leave it and even rinse it out, it sits there, has a telltale smell. That telltale smell is Pseudomonas aeruginosa. So you should never wash your dishes or anything with anything made of cotton. Make sure you use a fiber to do that kind of thing. So here in, it covers off, goes to cystic fibrosis, multiple sclerosis, all of these types of things. And it can, using this as in studies have shown that it supports really a great decrease in the incident of these things happening, and particularly comes with some of these increased body weight. So the final one is it's very effective against fungi. So when you think about that, rota and retroviruses, gram-positive, gram-negative bacteria, and all of the different things it's doing, this product, this is the nuke of them all and probiotics to go after these types of things. So a lot of this I'll let you read because we're at your own leisure, but here we're talking about many of the afflictions that it supports the body against, and it's extremely effective for influenza virus, and not just in fighting it if it happens, but in building the body up so that it's very resistant to it. And if it does happen to you, you're literally in studies that's showing the recovery time is twice as fast and the severity is about half of what it is if it's not. So that's pretty effective, especially with flu seasons coming on and things like that. So then we get into just so many of these things. I won't go through them all because it takes a long time to do that, but you can read these and you can see just what it does. So here it's about inflammation. And in inflammation, that is what causes the damage for most diseases. It's not the disease itself, it's the inflammation that is created after it that causes the damage. And so this is very powerful for inflammatory response, because one thing, if you have something like that, you know, your gut gets affected quickly. It gets sick, it's out of balance, and the inflammation goes through it, through all the tissues, but it starts with the stomach and goes through it. So that's why it's important to keep this in balance. So then asthma is a big thing. You asked about asthma. Well, that's been a hard thing for people to do, but this has a profound effect on the issues of asthma in supporting the biological processes in it for keeping down the irritation, the inflammation, the asthma that's occurring. And this is one, if you have a child or anyone else yourself that's asthmatic, this can make a very significant improvement as it supports the body in this area. Now, we're talking about 19 things and we're to number 10 only. So if you look at this, we're talking about now for food allergies, oral tolerance in milk allergies in children. So that's so you know, you can have, and some people say that, oh, they're lactose intolerant. And you know what, in most of the people that say they're lactose intolerant, this product here will make it so that it's tolerant with those. And so it's very good for that, and in allergies, and even in things like peanuts has a lot of allergies. And this is one that is very effective with the body to combat that. So then we're talking about a program for immunological support, which is very powerful. And it's in prenatal and postnatal pediatric care, families with histories of certain types of atrophic diseases, and especially in children where they have such a time because they're enzyme inefficient or deficient. This can bring it right up to where they're great in the ages of 2 up through 7 or 8. It's very effective. So then number 11 is for supporting the skin. Who would think that probiotics in your stomach and the prebiotics that blossom would be good for skin? But it really does. And these are scientific studies that have been proven on it. And because it's working with epigenetics, that's the expression of genes, and they are involved with insulin signaling, which is very important to increase the metabolism of the skin and the appearance of even adult acne, because it's functioning differently with that. And so you have an improvement there. Eczema is another factor that it's very effective for. And children up to the age of 6 are very high risk, so it works great for that. And then, of course, nose infections, all of that, atopic dermatitis. You look at the oral application of it is really great for the inflammation, which causes dermatitis. And then you have your urogenital infections, and that's a big problem with this because it can get really out of balance with bad bacteria. And I'll give you a couple of suggestions. If you're taking this kind of thing, this type of probiotic, it's going to go in and it's going to balance those good bacteria and suppress the negative bacteria. So that will help with lots of different types of infections you have. Could it be a bladder infection, a vaginal infection, any of things like that? It's very effective for. And to not only take care of it, but if you're diligent with it, to have a reoccurrence with it. See if yeah, okay. Now here we're talking about, and this is the unmentionable one, about cancer, because we can't say it kills cancer. That's the kiss of death for anybody doing or not. But the body has the ability. We all have cancer cells in us right now, and our body is, if we don't have a cancer that's getting into the 1 through 4 degrees of terminality, these cancer cells that we all have are being handled by our own body's biological system. But as we age, much of that deteriorates, and particularly our immune system gets dumbed down to becoming old and feeble, and it can't identify the cancer cells or pathogens that are within the system. So, and with things like the H pill, to proliferate the tissues, that's great. But if you don't have it, those are all diminishing. So if you want to really support your body in a number of ways you can do for keeping cancer at bay, things are very good, like Spectromax, which is loaded with antioxidants and eternity and that, Fucoidan, Avenger. Those are very powerful ones for doing those types of things. But this does too, and you can see from these studies, and these are all clinical studies, and I don't think people would really want the references to them, but we have them. Somebody really did, but you really want to sell the benefits, not the features. So I wouldn't look for that. So look at this last sentence. It's showed to enhance a decrease in the incidence of carcinogenic induced colon tumors and precancerous lesions in human cells, and anti-tumoral effects and bladder cancer. All of that from a probiotic. Yeah, that's the kind of support that it offers. So it's incredible that way. Now we're talking about, we live in a polluted atmosphere. It's just not Liesel's room. It's all around the world. We've got pollutants and toxins everywhere. And with this, it is significant in reducing the absorption of many different types of toxins. In fact, as many of these can be chelated and bound so they don't enter and they're discharged from the system. And here is, it shows that it's effective for depression. Well, a lot of people have depression. So it's something that, it's not like taking a Valium and suddenly you're gaga. This is the kind of thing that puts your body in sync. So depression, now it's elevated up and you feel better, and it's not such a hard hit like a pharmaceutical. It's just handling it in a natural, highly effective way with natural complementary medicines. So, and the same thing goes with anxiety issues. So it's really great against anxiety. And if you have anyone that does have anxiety, there's a gene in the brain that causes that. We know what the gene is. And while this works in some of the issues that causes anxiety, the gene has the ability to be sequestered if you have enough of a type of ingredient in it, in your system, to do it. And that ingredient is found in brain vitality. So it can sequester or support the sequestering of the gene that causes anxiety. And I've seen people who have panic attacks, and I put some on it there. One woman I remember was having a panic attack, and Liesel remembers who she is because I was married her. But she was having panic attacks, not because she was engaged to me, but because she was having panic attacks. And she was having 2-3 a week, and I started her on this. And when I did, they stopped. She had 2 for the rest of her life. Now she's permanently over it because of that. So if you have that, brain vitality goes really well for Balance D in working on that. So
Now, Dad, they're asking what the dosage is for pregnant women and children.
okay, well, the follow the directions. Okay, here's 2 things to think of. If you have a child that's under 100 pounds, give them half a dosage. Why? Because the half amount will go far the same ratio as it does if you're over 100 pounds. So that's kind of a rule of thumb to do it. Now, if you have something that's very serious, you're an adult, you don't really have to go beyond the recommended amounts. It is so powerful because we're not talking about 30 billion colonies of a couple of okay probiotics. We're talking about 520 billion or 5 billion colonies of this. So a little goes a long ways, and you don't need to give a normal child. In fact, there's one thing you can do if you have problems with infants and things like that, because it comes in a capsule. You can pull a capsule apart, and you can mix it in anything, baby food, yogurt, all of that, and it will never upset the baby's system. In fact, what it'll really do is help to improve it. So hope that answers that question for you. So then here's 19. It can assist factors involved to reduce the feelings of pain. Now that's a different thing. We're not talking about an aspirin to do it, but there are a number of things that have to do with pain, and those biological systems within your body can work on those, particularly with visceral pain that you can get. And in process of doing it, you have problems within the endocrine system, like serotonin and the noradrenal and dopamine that is in the brain too. And so this is a product to embellish that, so that if you're a person that has a lot of everyday pain or chronic pain, this is a good one to help with it. But then if it ever becomes a lot, well, we're bringing CDB out. We've got it in many countries around the world. It's been very hard to do. And I can't guarantee it because Australia is so difficult, but we think we found a way to do that. But we're not going to reveal it until we get it done, because we don't want to give false hope. But we are working on it aggressively. Okay, so.
Another question they have is, can this be given to a dog?
Oh yeah, it's really great for animals. You can give it dog, cat, it is compatible with any type of animal. I've even given some to my ex-mother-in-law, and it worked on her. So it doesn't matter what kind of animal you have, it will work on. You can put it, I don't know how the attributed effects would be to birds or poultry, and probably that's not so relevant, but a dog or a cat or a larger mammal, it's absolutely in their system. This is mammalian, so it'll have a great effect with it. And so this last page these are the conclusions to consider, and he goes through. We have, perhaps with the increase in the better prebiotics, this product's maybe 30 times more powerful. 30 times is a lot. If you just take from 30 billion to 525 billion in comparison, that's huge. And then when you have a much better prebiotic system to feed it, then the multiplication, this is a matter of mathematics, the multiplication multiplies and it gets bigger. And then the type with the last one we've been talking about, the rhamnosus, is so proliferate, and it proliferates so fast, as does the vulgaris, that you can repopulate your system really fast, where some probiotics, most of them, they're more older technologies, are slow acting. And so then the final thing is how are we going to clean up a lot of what's there? I mean, if you're killing the body is killing the bacteria, the bad bacteria, you're promoting new good bacteria. You have things like inflammation and different things like that. That's why we have a fiber balance in it that's really good. And it comes from chicory root, and it's an legal inulin, and they both absorb and scour at the same time and bind to these so they can be removed from the system. So here's a lot more, which we've really reiterated. This is the summary of what we've been talking about. And so with the immense amount of power, 3 types of probiotics, two types of prebiotics that are much better varieties, higher concentrations, you all have a significant difference. This is the final recap. And this shows you a comparison between our formula and a competitor, unnamed, one's comparison. You look at 30 billion colonies there, 525 billion colonies. Which one do you want to put in your system? The other thing that's so interesting about this with this comparison, if you take a look at it, they have 30 billion colonies between two of the two probiotics. So let's say it was 10 billion and 20 billion together, that's 30 billion. We have 525 billion, and the probiotics are much more powerful. So you're looking at this saying, what's the cost of making this product compared to the other? And well, it's a more expensive product to make. But the beautiful thing about it is, and I don't know, I'm putting some disclaimers in this, we have to do it. So, oops. So that's the end of the slideshow. So here's what I'm going to tell you in comparison. The product that we were comparing against sells for a little bit more money than our product does. Maybe 25% more, 20% more. But guess what? It's a 15-day supply. And so for less money, you get a 30-day supply of our products. So not only are the formulations vastly superior that we have versus a low concentration inferior one, the price goes high in theirs and goes way down in ours to use. So it's better than twice as inexpensive to use. And how many times? 20, 30 times potentially more power? That's the kind of way, that's the way we make products. And because we have this large manufacturing plant, no debt load, none of those things, we can, and the profit in making a product, when we make products for many companies, never ours, their own formulas, because frankly, I don't want any of those, wouldn't have them. But with ours, that margin that we charge a company, you have so much product cost and then you have the profit margin, we just increase it with product. And so you have ingredients they would never consider buying, concentrations that no one else would put into a product, varieties of powerful ones, all coming together in a symbiotic relationship to directly address whatever is the specific that you're doing. But it's not a silver bullet, a magic bullet. It's a combination of everything to accomplish that. And that's how we build our formulations. So anyway, that took quite a while, but that's my presentation for today. So you can understand about it. And the beautiful thing about it, that's a lot to talk about. And you can see even me, I can talk fast about these things, but there is so much. So now you'll have the document. You can go over it, just highlight a few of the things, because all of the particular things, you've got them for a reference if you want it. But you've got an enormous amount of information here, which you would never, ever see from another company. So anyway, I'll turn the time over to you, Lisa, to run it, since you have usurped my authority as the host, and I'll let you go ahead with the rest of what you want.
Yeah, you know, Dad, there were actually 2 or 3 questions that came up that said, you know, 7 pills is a lot. And can you give them any different ways of taking that. So especially giving those to children or even themselves when they're taking other products, it can be a lot to them. Do you have any suggestions for that?
Well, I got a bottle of it right here. Let me get my glasses on here for a second. So when you're taking 7 pills, there's a number of things you can do. That gives you what we consider the maximum amount. But I want to show you one thing here. These are very small pills. It's not the count. They're very small, and the reason we do it is particularly so children can absorb those easy. So if you look at that in comparison to some of the other capsules, really not pills, but when you see how teeny that is, 7 is like 3 or 4 of it. And if you have a child, you give them 3 of these little ones, it's easy. So understand, it's not the count that matters so much, it's the volume and the size of each one. And these are small for that purpose.
Okay, awesome. Thanks, Dad. So let me make sure we don't have another question here. And I don't think so. Everyone is absolutely loving this, obviously. I did have someone say that people can dissolve them in baby food.
Yeah, it's really easy. You could actually, they don't taste bad at all. You could actually dump some in your mouth, hold it under your tongue if you wanted, or anywhere. But you really want to get it in the gut. But it's that good and compatible.
All right, and Mark,
Just going to say thank you. Well,
absolutely loving these.
Every single formulation we do, so the comparison between what we have and the needs that's there are maximized rather than just tokenized as it is with most other products.
Well, that's awesome. I appreciate that. Now, next, again, we want to thank Tom.
Hold on.
Oh, boy.
One more thing.
Okay.
For you Aussies and Kiwis that are down there, we know it's hard when you're on the other end of the world and they just see they're just having the world's record flight going from London to Australia of 23 hours they're testing to see if people can hold up for it. So sure, the distance and everything makes it difficult to do, but as we are greatly improving, and you've seen that, and as our distribution is becoming bigger, the sales become more, we can do more with all of these things, and we're gonna go to gigantic size. But the one thing that drives a company is spectacular. Well, it's a business opportunity, and that is supported by a really great compensation plan, which we have, and products that yeah, they fill everyday things, but they are so much better than anything else in the world. But being down on the far end, it's a while before it trickles down to you. And so we're air freighting and doing things like this. But Liesel and I have to give her credit for this. She said, I want something out for the Australian distributors before anyone else in the world has it. So I said, okay, I mean, just kind of casually, but we are working on something. And think of this. If you have aged skin, you have lines, you have eye bags, you have wrinkles, you have crow's feet, you have crepe skin, sagging skin, all of that. What happens is that is a direct response to environmental damage, most of it from light. And of course, the skin breathes from the outside, doesn't breathe through your lungs. So you get a lot of toxins in that way. But environmental fluorescent lights like I have here damage my skin. As indirect sunlight coming through will damage your skin. Direct sunlight, of course, is the worst. So what happens as that radiation, for instance, beats down on the skin, it will oxidize like rusting, and those bonds will break. The skin, to protect it now, because it's so vulnerable, pulls it in. And so that's why you have the wrinkles, the fold, the creping, to protect that damage. So now, you've never heard anybody talk like this, because there's never been anyone that really could provide. They could talk about it, but they couldn't provide a solution. We have the solution, and it's going to be in Australia first. We're going to launch it. And what this does is you're going to be able to coat lines and things like that with it and rub it in, and it will, its cause, that damage activates an age gene, okay? So the age gene is switched on and it folds in. We have compounds that will turn off the aging gene and it will come back. Now, that's pretty good, but if it's still damaged, we're going to do lots of things to increase proliferation rate. And eye bags are because you don't have enough fat in the eye, and we can do that and do all of these things. But this product, think of this. You could say, would you like to turn off the aging switch, the epigenetic aging switch in your skin? And you can do it, and you'll see a visible change, according to the studies on the ingredients, in 14 days. And because of that, we're going to be doing a revision here. We're working on it right now in Transfigure and in Rapid Repair to be in concert with that. So if we switch off the aging gene, then we can put these super products down in there to make it all work faster. And I don't know I don't know if I'm going to do it or not, but I've literally been thinking you could sell this to somebody, and if they didn't see results, visible results in 30 days, give them their money back. That's how strongly I feel about that. So we're working aggressively on that, and it's for you first. So get excited about that one, because that is really a big breakthrough.
Yeah, and actually, Dad's been looking at a lot of different ingredients, science for our skincare line. I've had a lot of distributors talk to me lately saying just skincare, you know, for many of us, especially our Australian distributors, the skincare line is their favorite line. That's where they want to build. That's what they want to build their business with. And we understand that. And trust me, Tom is always looking at that science. He's found some great stuff. Just like he said, he's working on it. I think more than 1 or 2 products in our skincare line will get a great facelift, and it will be beyond anything out there. Like he says, there's no way to talk about this right now because he's got science that no one else has. This is exciting, and so he's kind of announcing it right now, but we'll put the whip on and get it done and get it to you guys as soon as possible, and you guys will love it. It'll just be awesome. So, and we'll get out to you guys. So super excited. So go to Facebook. Make sure you put your guess in on our lotion. You can see all our posts. You'll also see our posts on the rewards program, how it works. Make sure you familiarize yourself with that. A lot of people are going to their back office and seeing that they've missed some months for that. We don't want anyone to miss that. You've earned it. Use it, spend it. That's why we did this program. It's one of our most popular programs. So we wanted to make sure our creative department has put out some brochures type things on there that you guys can see today. You can print those off. They look amazing. I mean, they are just top class. So go there, take them and show them to your group and make sure that you know how that works, because it can be a little bit confusing at first, but they've just got an amazing way they put it together so no one can ever miss out on that way before. Again, we want to thank Tom. He's done a great job, and honestly, he's been just great to support me in any way with Australia. He really wants Australia just to do exactly what the US is doing, and they're just growing with every month, beating the month before. We've got some good things going in Australia. He's here to support us. He's committed to doing training with us every other week on our country calls, pulling out the products. So we're going to take him up on his offer and get him here. So bring your group here. And we appreciate you guys being with us, and have a great rest of the weekend. See you later. Thanks.
And one little tip for those, I'm going to give you some inside information. The fragrance in the new lotion is lilac.
I'm just so scared he's going to do something. I just want him to get off the call. Have a great weekend, everybody.
Bye, everybody. See you down under. I'm coming soon. I'll be down after the first year. I'm not sending Lisa. I'm coming.
Yeah, I'm coming.
Okay, bye-bye, everybody.